Okay, so first aid basic. My name is Jeanie Jones. I am the Pathfinder Director of the Oak Gold Pathfinder Club, and this is the 2020 version. I don't want it doing the automatic. This honor is a component of the Health Master Award. It's a skill level 1, and this honor is related to the investiture achievement requirements for companion, health fitness, and required completion of this honor. If residing in the United States or another country where the Red Cross instructions are given or is given, satisfactory pass the Red Cross examination in first aid and receive your certificate. If you are in the British countries, pass the examination in St. John Ambulance and receive your certificate for the same. So our first one is know the cause of shock and demonstrate its proper treatment. How many of you out there know what shock is? The causes of shock is lack of blood circulation, so less oxygen and nutrients to meet the body's needs. How do we see it and recognize it? Your victim is going to be restless, irritable, have altered consciousness, pale, cool, damp skin, rapid breathing, and rapid pulse. So the treatment for shock would be, first, you're going to call 911. If possible, you're going to lay the victim down and elevate their feet 12 inches unless the head, neck, or back are injured, or you suspect a broken hip or leg bones do not raise. Do not raise the victim's head if these are there, okay? You're going to turn the victim to the side if you think he's going to be vomiting or if there's bleeding from the mouth. If you need to, then you're going to process and start your CPR. If the victim is not breathing or breathing seems dangerously weak, then you're going to continue till help arrives or victim wakes up. Treat obvious injuries. Keep the victim warm and comfortable. Loosen restricted clothing like around the neck. Cover the victim with a coat or lightweight blanket. Keep the victim still. Do not move the victim unless there is danger. Reassure the victim you are here to help. Do not give anything to drink because they may go out and then start choking. Any questions on shock? Okay, we'll go to rescue breathing. Know the proper steps for rescue breathing. This is a picture of how it's done. You pinch the nose, tilt the head back, and do a head tilt, chin lift, and seal your lips around the victim's mouth. Now, the American Heart Association changes their regulations every 5 years. The last time they changed it was 2015. At that time, they used the ABC, which was assess the patient, breathing for the patient, giving your 2 quick breaths, and then you start your compressions. Now it's CAB, compressions first, airway open, and then start breathing for the patient. This they felt helped the patient sooner or the victim sooner. Your compressions, you're going to do 30 at a rate of 100 per minute. And if you don't know how fast that is, there's a song called, forget what it's called, but it's by John Travolta. And we use it in nursing, is saving a life. Airway, open the mouth, check to see if it is clear and if there's any bleeding. So you can give 2 slow breaths with mouth sealed around the victim, like I had explained earlier, and pinch the nose. Tilt head back gently, lift the chin, pinch the nose. Make a seal around the mouth. Give 2 slow breaths over 2 minutes, or 2 minutes. Let's try 2 seconds. Mouth to mouth is good, and it is the most used way. But if you can't get anything, try the nose. So you're going to do mouth to nose with the mouth closed. If you are the first one on the scene, you need to check, make sure that the area has no danger for you or the victim. You're going to call 911 yourself, or if another person shows up, send them to call. You need a description of what happened, and you're going to need to tell them where you are. So check, call, and care are these guidelines. Care is provided appropriately until the EMS arrives. Okay, requirement 3. We've all seen someone choking because of either swallowing wrong or acting like they're choking, but there's a universal sign. If a victim is choking but coughing, you just watch. When they go like this, grab their neck. When they grab their neck like this and they can't cough, then you need to do what is called a Heimlich maneuver. Ways to do the Heimlich maneuver are these such ways. You get behind the victim, you interlock your fists just below the breastbone and above the belly button, and you squeeze. This will dislodge whatever is stuck in their throat. If there's no one around and it's only you, you can use a chair. Another way to do it is lay down on the victim, squat over them, and push up against the breastbone. So you're going to push up, okay? Any questions with that? Okay, we'll go on. Requirement 4, know the proper procedures to assist a bleeding victim. So in this picture, we have arteries that are nicked or cut. And how do you know it's an artery? It's going to be spurting blood. The flow is going to be pulsating, and it's going to be bright red in color. If it's a vein, slow, even flow, and a darker red color. Capillaries, that's more surface and still a slow, even flow. So with external bleeding and the treatment, you're assessing where the bleeding is on the victim. Is it an artery? Then you're going to hold pressure above the bleeding with a clean, dry dressing. If bleeding continues, you're going to use a tourniquet. If the bleeding still continues, then you may need to use a second tourniquet to the limb. So one is above the bleeding and one is below the bleeding. If it is a vein, you're going to hold pressure till it stops bleeding with a clean dressing. Raise the arm above the heart. And you can do this also with the artery if it's your arms. Depending on how much blood loss there was, you're going to assess for shock, and you're going to treat shock, and you're going to call 911. Okay. Now we're going to know where the pressure points are, also to help stop bleeding. So you're going to apply pressure with your hands and apply a dressing and press or apply a tourniquet. Okay. These are the pressure points on a victim or on a person. With the head, you got the temporal, you got the facial, you got the neck, which is the carotid, and down in your shoulder blade or the subclavian, you have pulses in all those places. The upper limbs, you got your inside of your elbows, the brachial. Your radial is the outside of your wrist. I don't know if you can see me. And then the lunar is the other side, okay? With the lower limbs, your femoral is in your groin. And here you're gonna hold with your heel of the hand, because you can, with the heel of your hand, you can do more pressing down than you can with your fingers. The popliteal is at the knee, and the tibial is at the ankle. So keep these in mind. So when you're out camping, somebody gets injured, you know where to hold pressure. Any questions on the pressure points? Okay. Requirement 6. What is the proper procedure to assist a victim in poisoning? You're going to want to know this number, and it's a universal number. It's an 800 number, and that means it's free to call. There's different types of poisoning. There's food, there's heavy metal, there's chemical, there's drugs, and they can be ingested, inhaled, injected, or absorbed. These are just some poison signs that I have picked up. So what you're going to do is you're going to call the poison control with poison in hand. You will not make the victim vomit unless you are instructed to do so. Because if you try to do that, you're going to cause more harm. If it's on the clothes, then you got to remove the clothes. If it got into the eyes, then you need to flush the eyes with clean water for 10 minutes and get the victim to the ER as soon as possible. Number 7, requirement 7, demonstrate the proper procedure in splinting various broken bones in the body. Here are some makeshift splint ideas when you're out in the woods. You can make padded boards, tree limbs, rolled newspaper, length of wood, and if you need to, use the good leg with the bad leg and tie them together. Here are different splints. I don't know how well you can see them, but this is your stretcher or your leader. And these are the two legs strapped together. And what you're going to want to do is make 2 above the knee and 1 below the knee. Here is a sling. Okay. Anatomic or an anatomical splint is support the injured area above and below the site of the injury. Check the feeling, warmth, and color. Make sure that the circulation is still going. Place several folded triangle bandages above and below the injured area. Place uninjured area next to the injured area. So you can only do this with maybe your fingers or your legs. Tie a triangular bandage securely. And again, with those dressings on, you want to make sure that you didn't cut off the circulation. So you're going to check the feeling, warmth, and color. A soft splint, almost the same, a little bit different. Support the injured area above and below the site of the injury. Check for feeling, warmth, and color, and this again is you're checking the circulation. Place several folded triangular bandages above and below the injured area. Gently wrap soft object, a folded blanket or a pillow around the injured area. Then tie your triangular bandages securely. And again, we're rechecking the circulation, make sure we didn't cut it off by feeling for warmth and color. Make sure the victim feels your fingers. Why is it doing that? Just a minute, it's wanting to save something here. The next one we're going to do is applying a rigid splint. Support the injured area above and below the site of the injury. Check the feeling, warmth, and color. Make sure the circulation didn't get cut off by the injury. Place the rigid splint, a board that's going to be padded, under the injured area and joints that are above and below the injured area. Then again, you're going to tie several folded triangle bandages above and below the injured area. And again, making sure that you didn't cut off any circulation. You're going to see if they can feel your fingers, and you check for the warmth and the color. Make sure it's not blue and it's not cold. Applying a sling. Now, a sling can be made out of your Pathfinder scarf, this scarf right here. And there is an honor that uses the scarf, if you want to check that out later. Support the injured area above and below the site of injury. Check for feeling, warmth, and color. Place a triangular bandage under the injured arm and over an injured shoulder to form a sling. Tie the ends of the sling at the side of the neck. Bind injured area to the chest with folded triangular bandage and recheck again for the circulation, the feeling, the warmth, and the color. So you're going to have a sling around under your arm and tied over your neck. And then with another one, you're going to put it around your waist, so it protects it more.
Jeanie?
Yes.
Some people are asking on some of these slides if you can slow down moving between them, because they're trying to take their notes.
Oh, sorry. Okay, sure.
That's okay.
Do I need to back up?
No, there's just a lot to write. People can also, you guys can come back and watch it again and again. This is being archived. So if you need to go through and catch up, you can just bring it back up and zip to where you are short a few notes and just fill in your notes.
We can also probably send you the file as well.
Okay, excellent. All right, continue.
And I'll try to go slower for y'all. I know what it's like trying to take notes. By the time you figure out what you need to write, it's gone. All right, let me know when we're ready.
You should be good.
Okay. Splinting a knee. And we've also got ankle wraps here. That's a figure 8 wrap. You can see here that they've used some sticks or twigs to make a splint. And then they're, oh, I don't want to do that. Back here. They've got third bandages here. They've got 4 of them. Come on, computer. So the materials you're going to need is a triangle bandages. You're going to need 3 of them. A board or your body. Remember the injured leg and the uninjured leg. So you're not going to move the knee. You're going to slide the triangle bandages into position under both legs, 2 above and 1 below the break. Then you're going to tie snug, but again, not too snug that you're cutting off the circulation. And you're going to check for feeling and movement. Okay. I know they have an arm here and an elbow, but this is for a knee. But I just thought I would throw that in there so you can see, you know, you can use other things. Oops. Okay. This one, I just loved it because it's using a triangle bandage and it's showing you different uses. But you know what? When we first started being Pathfinders, there was a reason for our scarf. It was used as a dressing. It was used for other things as well. I think that's one of my better slides that I like. So for bandage for first aid in accidents, it also uses our Pathfinder scarf. Okay, on to burns. I'll go slow through this because there's a lot of information here. Requirement 8, know the proper procedure to assist a first, second, and third degree burn victims. So your care for your burns, these are the do's. There's do's and there's don'ts. So we're going to stop the burning by removing the victim from the fire or from a burned area or burning area. We're going to cool the burn down with cool water. Never use ice or ice water. This damages the outer skin. If it's close to home, use a tub or a shower. If it's outside, you can use a garden hose. The important thing is to keep the clothes cool and wet. Cover the burn with a dry, sterile dressing or clean cloth. Covering a burn helps the burning to be less painful and keeps infection out. Care for the burns, these are the don'ts. So do not apply ice directly to any burns unless it is very minor. Don't touch a burn with anything except a clean covering. Don't remove pieces of cloth that stick to the burned area except in chemical burns. Don't try to clean a severe burn. Don't break blisters. And that is because if you break the blister, there's an open area now for infection. The blister actually protects the wound from getting infected as long as it is intact. Don't use any kind of ointment on a severe burn. I know when I was younger, I would burn my hand on a skillet or a pan or something. Go put some butter on it. Go put some grease on it. That's the wrong thing to do. That holds in the heat. Any questions?
You say no ointment. Can you use
Nothing,
nothing?
nothing. Clean, dry dressing. Okay. Now we say first, second, and third degree burns. This is the explanation of those levels of burns. We have 3 levels of skin, and then we have bone and muscle. So your epidermis, that's your very top layer of skin. This one is primarily just going to get burnt by laying out in the sun or being outside, and you get a little sunburn. Second degree burn includes the epidermis and the dermis. So now you've got the 2 layers of skin. Okay. A third degree burn goes all the way down and can down into the bone. And it's done a lot of tissue damage. Okay. So you got your dermis, epidermis, dermis, hypodermis, muscle, and bone. So this is kind of a side view. This is a first degree burn. This is a second degree burn. This is a third degree burn.
What can cause third degree burns and second degree burns?
Electrical, chemical, radiation, and we'll go into that. Okay. Difference between first and second degree burns is the first degree burn is superficial, involves only the top part of the skin. It is red and dry and usually painful. The areas may swell, mostly caused by a sunburn. This will heal usually in 5 to 6 days without the scarring. Your second degree burn equals partial thickness. It involves the top layers of skin. The skin is red, has blisters that may be open and weeping clear fluid, making the skin appear wet. The burned skin may appear molted. These burns are usually painful and the area often swells. The burn usually heals in 3 to 4 weeks. So first degree heals in 5 to 6 days. The second degree takes 3 to 4 weeks, and there is possibly going to be scarring. Okay. Third degree burn is the full thickness, destroys all layers of skin and any or all of the underlying structures, such as the fat, the muscles, the bones, and the nerves. So in a third degree burn, if it destroys the nerves, they don't have much pain. If it hasn't destroyed the nerves, they're going to be severely painful. These burns look brown or black, kind of like if you're barbecuing hamburger or a hot dog and it gets well done and it's charred. That could be like your skin in a third degree. They can either be extremely painful or relatively painless if the burn destroys the nerve endings. Okay, now we're going to go into the different types of burns. Thermal burn is a heat burn. So it's caused by fire, steam, hot objects, or hot liquid. So scalding water, hot chocolate, if it gets on you, it can make a blister. It can turn red. It can be painful. Those are called thermal burns. And here's some examples for you for the thermal. Okay. I feel sorry for this person right here. That looks so painful. Okay, then we have electrical burns. So our sources of electrical burns can be either frayed or broken wires. It could be lightning. If you get struck by lightning. Now, this particular one was electrical shock. You can see where it got electrocuted by the electric lightning, and it came out the foot. Looks pretty painful. Can you see that? And then this is the hand that got electrocuted as well by either or wire, or I'm not sure which. But for the burns of an electrical first aid, an electrical burn may appear minor or not show on the skin at all. But the damage can be extended deep into the tissues beneath your skin. If a strong electrical current passes through your body, causing internal damage, such as a heart rhythm, disturbance in the cardiac disturbance, or cardiac arrest, a jolt associated with the electrical burn can cause you to be thrown or fall. I worked with a couple of nurses that got electrocuted by faulty wiring system on the beds. And they felt it go through them, and it knocked them for a loop. And we had to do blood draws to make sure that the salts in our body did not affect her heart, and that her heart was okay. It was quite scary. If you are in an electrical storm, you know not to be on the phone or near windows or any of that such thing. My daughter was on the phone when we were in Oklahoma, and a lightning bolt came through. She did not get hurt, but it took very well damage of the phone. It didn't work anymore. She was very, very lucky. She says she feels it in her ear. Okay, so now we have radiation burns. Radiation is all over. The sun causes us to have radiation. The tanning beds give off radiation. And if you're tanning outside, x-rays or radiation during radiation therapy for those that are getting radiation treatment for cancer. Steps to assist casualty: cool burnt area with cool running water for a minimum of 20 minutes. If the pain returns, repeat the cooling. Move casualty to shaded area. Give the casualty frequent small drinks of clear fluid. You're going to call an ambulance if there is a large area affected by radiation burn, or there is extensive blistering, or the eyes are affected. So this one here is a radiation burn. She was getting radiation. This is person getting radiation. And then this is a burn on the hand. Okay. Any questions? Are you able to keep up? Okay. Requirement 9. What is the proper procedure to assist a victim of a chemical burn? Wet chemicals immediately flush the area with large amounts of water, a shower or hose for 20 minutes. Remove the clothes while flooding with water. If it's a dry chemical, brush off the chemical, then flush water as above. So you got your wet chemicals and you got your dry chemicals. Both can burn. These are some pictures of chemical burns. Now, We have a lot of chemicals in our house. Our cleaning solutions are full of chemicals. Your scouring powder is a chemical. So chemical burns are caused by contact with industrial or household chemicals. They can be either solid or liquid or in a gaseous form. Signs and symptoms, history of seeing chemical containers, split chemicals, fumes. You're going to have a lot of pain, swelling, blistering to the affected area. They can have difficulty breathing. Clothing is sticking to the skin. Okay, come on. Okay. This is an acid burn. Battery acid, or things that have carbolic acid or phenol. These are acid burns. So you're going to wash these off with alcohol first because phenol is not water soluble. Then wash with water, and you need to call the emergency medical system 911. They're pretty nasty. Looks like they could have been painful. Okay, requirement 10. So what are some situations that you might have carbon monoxide? If a car is running inside a garage and it's closed up, let's say in the wintertime, you started your car because you want it warm when you get in there, but you're at risk for getting carbon monoxide. Also, if you're running a generator of sorts. Know what the situations are likely to cause carbon monoxide poisoning and rescue the treatment techniques for such poisoning. Signs, symptoms, and the treatment of carbon monoxide. Victims that are poisoned with carbon monoxide will have a headache. They'll be nauseated, sick to their stomach. They'll have dizziness, breathlessness, possibly collapse, and be unconscious. Their vision could be blurred, and their skin on the later stages turns a cherry red. Death may occur in a few minutes from being in this cherry red stage. So what do you want to do to protect the victim and treat him or them? You're going to move the victim to fresh air away from the carbon monoxide. If the victim is unconscious, you need to check for injuries and breathing. Turn the victim on side if vomiting and start CPR if victim is not breathing. So these things here are all things, items that can cause carbon monoxide. Car left running in an attached garage. Portable generator. Hot water heater, warmer, a kerosene or gas heater, loose or broken vent pipes, improperly installed kitchen range or vent, especially if it's gas operated, not electrical, opening a grill, or in a garage, indoors or in garage, and glass or wood burning fireplace. So these all can give you carbon monoxide. So you want to be careful what you're doing and where you are. Here's our friend Kermit again. Know the proper procedure for giving assistance to the victim of a head injury. Oh my aching head. Here's Kermit, he's got an aching head. He's got his hand up on his head. And this is warning signs after a head injury, okay? In the first 24 hours, you're gonna have a change in the level of consciousness. You could have increased drowsiness, confusion, difficult to arouse, seizures, bleeding or watery drainage from the nose or ears, pupils slow to react or unequal. And that's pupils of your eyes are the dark centers, okay? Blurred vision, loss of sensation to any extremity, and slurred speech or vomiting. So all those can happen when you have a head injury. And head injuries in this instances could be a concussion. If you fell and hit your head, okay? Are we doing all right? Okay. Assessment and treatment, head injury. This poor fellow here has had a head trauma. So in these people, you never give any medicine. Keep the victim flat. Wound back of head, turn the victim to the side. Watch closely for vomiting. Position victim to avoid fluids going down into the lungs. Do not apply direct pressure to control the bleeding if the skull is depressed or fractured. So that kind of depends on how bad they got hurt. If it was pretty bad, you're going to have a depression in your skull. And this is where you do not apply direct pressure, but just try to keep it clean and dry.
Question.
Yes.
Why? Why never give any medicine and keep the victim flat?
You don't give them medicine because it can alter their consciousness. It will impede the diagnostic of what his symptoms are. So the doctor and the emergency people can better assess. And he may vomit. What was your other question?
Keeping the victim flat?
You keep them flat because they could fall.
Okay.
Okay. Requirement 12, know the proper procedure for giving aid to a victim of internal injuries. This little dude got hit on the head or bumped. This is an owie on the ankle and it's already turning blue. That means there's broken vessels underneath the skin. This is a typical bruise. Okay, so those are internal injuries. Internal injuries are your visual indications. So you're going to look for vomiting bright red blood. And that could be if they have internal injuries in the abdomen or your belly. If you excrete dark tarry stools, that means you have a bleed below the stomach. Excretion of bright red blood from the rectum, that means you have hemorrhoids that are bleeding. If you have blood in the urine, your kidneys have been injured in some way. For women, non-menstrual vaginal bleeding, that could be a concern. If you have a nosebleed, pooling of blood near the surface of the skin, these are all internal visual indications. Non-visual signs are the pale, moist, clammy skin like in a shock, subnormal temperature, so they're going to be chilled. Their pulse is going to be feeble. You can barely feel it, and it may not be feelable at all, and it's going to be increased. The rate's going to be up. A falling of blood pressure, ringing in the ears, fainting because of the lack of blood, and dehydration and thirst, also from a lack of blood, and yawning and air hunger because you don't have the blood to help the oxygen circulate around in your body. So your first aid for these is to treat for shock. And again, you're going to keep the victim warm and at rest. You're not going to give them anything to drink. You're going to splint the injured extremities, apply cold compresses or ice packs to identifiable injured areas. Transport the victim to a medical treatment facility as soon as possible. Okay. Requirement 13. So what's the difference between a heart attack and a stroke, an epilepsy seizure, or a simple fainting? Any clues out there? You ever seen anybody faint? Anybody in a seizure? Anybody that's had a stroke? Okay. So the cause of a heart attack and their symptoms is, heart attack is when the blood supply to part of the heart is interrupted by causing heart tissue to die. And that could be a lot of plaque in your arteries, which will block the blood from getting to where it needs to be. It is a medical emergency, and it is a leading cause of death. Okay. Heart attack. Men and women have different signs of a heart attack. Women usually have chest pain or discomfort, nausea, lightheaded, and or unusually tired. Pain or discomfort in the neck, the jaw, the back, arm, or shoulder. Shortness of breath. Men usually have chest pain, discomfort, pain or discomfort in the chest, pain or discomfort in the neck, jaw, back, arm, or shoulder. Sometimes short of breath. So women have a little more symptoms than men do. And working in a cardiac unit for lots of my years of practice, it is true. I could tell that one had a heart problem before I even was told. Okay. Heart attack treatment, you're going to seek EMS 911 now. A lot of people will be in denial. They won't want anybody to be called. It's just indigestion, it will go away. Those people more than likely are having a heart attack. You're going to position the victim sitting up on the floor with the knees bent and leaning against the wall or a bed. You're going to open windows and doors to allow more oxygen. Open the collar of a shirt. Cover with a blanket to keep them warm. You're going to give them chewable aspirin, not enteric coated, because that will not help them. If the victim has been prescribed nitroglycerin, You put it in, have them put it under their tongue, and 1 every 5 minutes until the discomfort has left. And you can tell them that it will feel hot briefly. It can lower the blood pressure, so that's why you want them sitting down or lying down. And you're going to monitor the pulse, the breathing, and level of consciousness. And if you need to, start CPR. Okay, here's our stroke. You can see this guy's face looks uneven. If he tries to smile, this side won't go up. It's affected by a block in the brain. One arm hanging down, they're not equal. This one's going to be weaker and maybe not even able to raise it that much. The speech could be slurred. You need to call 911 now. If you see somebody that's having these symptoms, call 911 now and give them time that it started or that you noticed it, because there is a 90-minute window for treatment. The cause of stroke and their treatment caused by interruption of the arterial blood supply to a portion of the brain. This interruption may be caused by hardening of the arteries or a clot forming in the brain. Tissue damage and loss of function is the result. Assess airway and keep it clear. You're going to call 911. Place the victim on affected side. Keep calm in the area and quiet. Assess the pulse in the neck, breathing and blood pressure, and keeping a log. The reason why you're going to have them on the affected side, because if they go to swallow, it may go down into their lungs. If you have them on their affected side, it will drain out of the mouth. Okay. Sometimes there's what we call transient ischemic attack. It's similar to a stroke, but it's intermittent, and they don't have lasting disabilities. Epilepsy or seizures. It's an abnormal focus of activity in the brain that produces severe motor responses or changes in consciousness. It can be controlled by medicine.
So is that because of flashing lights?
It could be caused by flashing lights. It could be caused by a certain smell. It could be caused by a certain noise. Most people. What did I do? Well, hang on a minute. Let me get a drink of water. Let the computer do its thing. Just check. Oh, there we go. Okay.
Okay.
I'll just go back up here. It's easier. Okay. So the different types of seizures is partial, generalized, or unclassified. I don't expect you to know these. It's just giving you more knowledge. There's absent seizures, formerly known as petit mal. They're very quiet. They're a calm seizure. Then there's the tonic-clonic seizures, formerly known as the grand mal, and this is total body motion involvement. The atonic seizure, formerly known as drop attacks. And the first aid basic for this is to stay with them, make sure they're safe, and that they are on their side once the seizure has passed.
One side.
Huh? Here, let's see. So what we're gonna do. So I just sort of. Yeah. Bear with me. My mouse made a wrong move.
There you go.
Holy mackerel. No. They don't want all those. Sorry, guys. There you go. The whole thing. Okay. Outline. Not that one either. All right, cool. That's what we know how to do it is exit out, exit out. Apologize. We'll be right back. Don't go anywhere. Close. Go back.
All right, everybody. Well, they're working on fixing whatever that was. If you have any questions, feel free to, it'd be a good time to throw them up on the sidebar. Just post the question to everyone and we can see it, and maybe Jeanie can answer it while her daughter's figuring out her PowerPoint there.
Okay. Nothing have it up here anymore. Open back up. That's fine.
Also, good time to get a drink. Here's a question. The Pathfinder handkerchief or silk things you mentioned at the beginning, one of our assistant area coordinators is working on an honor for what to do with a scarf, what its history, why Scouts wear them and everything. It's a Nevada, Utah conference honor we're working on, and we demoed it a few months ago. And if you go to our NUC Facebook page, you can view it in the archive of videos. And hopefully soon we'll be presenting it to the rest of the North America division, and we'll have the patch art for it here. So that's what she was talking about the scarf honor, the honor and development. And it's a really cool honor. Marcos is the one writing it.
Nope. Keep going. Almost there. Okay. All right. Thank you for bearing with us. We did that one, I think. Yes. And epilepsy. Actually, the question right there. That's the next one you're on. Okay. So next up. Okay, the safety in epilepsy. Sorry about that, folks. I am not computer literate. So you're going to stay with the person and start timing the event if you're there when it began. You're going to keep the person safe, away from sharp objects and other harmful items.
Jeanie, go ahead and reshare your screen.
Oh, am I not sharing? Oh, okay.
No, not right now.
Apologize.
That's okay.
Thank you for letting us know.
You're not the first to have done that.
I go share again. It's right there. There we go. Okay, sure. Now everyone can see. I'm having a lesson, giving a lesson. How's that?
Hey, this is Pathfinder. It's a safe place to learn and grow. Remember that.
All right, so you can all see the slide now?
Yes.
Okay. So again, let's start over then. Stay with a person and start timing the event. Keep the person safe, away from sharp objects or harmful items. Turn the person to their side if they are not awake and unaware of what they're doing. Do not put any objects in their mouth. It used to be that we would put a stick or something in their mouth so they wouldn't bite their tongue. This is not anymore because they found out that they break their teeth and other jaws and other things happen. Do not restrain them. Do not tie them down. Let them be free and nothing in their mouth. You're going to stay with them until they are awake and alert after the seizure. And when are you going to call 911? Let's go to our next slide.
What is epilepsy and why do you have to time the events? And
I believe it tells me. No. Okay, you're going to stay with the person and time it because if it lasts more than 5 minutes, you need to call 911. You're going to stay with the patient to make, or the victim that's having the seizure, to make sure there's no injuries to him. And you stay with them until they're fully awake and talk with them in a calm voice because they don't know how long they've been out. And sometimes they don't even know what happened, especially if it's their first one. Does that make sense?
what is epilepsy, basically?
I said it was.
Did you?
Yes.
Okay.
Okay, simple fainting. This little girl is going to go down. She won't feel well. The cause of simple fainting is the result of quick change in position from lying to standing. It's a gravitational pulling of the blood in your body. As the patient or the victim falls to the floor, blood rushes to their head and the problem is solved. Could be caused by stressful situations, could be caused by dehydration. The treatment of fainting is lay the victim down if not already down, elevate their feet, loosen tight clothing, and maintain an open airway.
I'm gonna call you Boomer.
You only have a half hour. Requirement 14, know how to prevent infection. Infection is a cause of spread of microorganisms, bacteria, viruses, fungi, and such to humans from other humans or animals or the environment. The best way to prevent it is to cough or sneeze into your Kleenex or hanky, into your elbow, and always, 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 please wash your hands frequently. Prevent infection. You're going to have good hand washing before and after dressing changes for the wounds and use hand sanitizer. Keep the wounds clean and dry. Use sterile dressings. Follow the chain of prevention. Bacteria that causes infection are the aerobic. They are the live and multiply in the presence of air or free oxygen. Anaerobic, this bacteria only multiplies in absence of air. So aerobic and anaerobic is also used, these terms are also used in exercise.
Miss
Okay,
Jeanie,
yeah,
I read somewhere that a bite could cause infections, like a bite from a human. Is that true?
yes, very true, yes. Yes, and we're going to learn more about that. Thank you, Sammy. Snake bites, your first aid, know your snake for the silver state. Rattlesnake is a foe and your gopher snake is a friend. These two snakes look very similar, but their head is different and their tails are different and their skin is different, okay? So rattlesnake is a venomous snake. So they have what? A triangle head, right? And the other one have an oval head. The body is mate or dull, and on a gopher snake, they're glossy. Rattlesnake ends bluntly with one or more rattles. But now remember, your young ones, they haven't grown them yet, and they're more venomous. So on the gopher snake, they have no rattles. Rattlesnakes like warm weather, and so do we as people. The gopher snake is a friend because it eats garden pests as mice, gophers, ground squirrels, which are known to spread diseases. If a gopher snake is in your yard, it will keep rattlesnakes away. I spelled that wrong. Could have got all those errors out. Okay, snake bite treatment. You're going to call 911. There is any chance the snake was venomous. The person has double trouble with breathing. There is a loss of consciousness. Note the snake appearance. Be ready to describe the snake to the emergency staff. Protect the person. Make sure that they're out of the striking distance and waiting on medical help. You're going to lay down with a wound lower than the heart because you don't want that to get up to their heart, the venom to get up to their heart. And you're going to keep them calm and be at rest. If the heart rate is up and they're all nervous, that's going to get the venom circulated throughout their body quicker. You're going to cover the wound with sterile bandage, remove any jewelry because most snake bites swell, and remove their shoes if the leg or the foot was bitten. Oops. Okay, somehow these got out of sync. So here's your venomous snake. It's got a triangle head, and your non-venomous, the oval. Okay. We don't cut the bite, we don't suck out the venom, and we do not apply a tourniquet, ice, or water. We do not give the person alcohol or caffeinated drinks because this, again, will alter the consciousness level and also increase the heart rate. Now on these next slides, in the chat, we have added these to the chat, and you can look at them later for sake of the time we have. So one is on snake bites, and it tells you the different snakes. It goes into the copper snake, the cottonmouth, the rattlesnake, and the coral snake. Okay, it's really enjoyable. They're slides. And then this one is on all animal bites, your ticks, your rats, skunk. And this one will have them all. Skin problems from bites, okay, and their treatment. 18, what is the difference between heat exhaustion and heat stroke? Anybody want to venture a guess?
Oh,
You want to guess, Sam? Huh?
what is it? A heat stroke? A heat exhaustion. A heat stroke is it makes you sweat and you turn like red, and you have like a heat stroke is when you turn red and you're just like really hot.
Okay. Do we have any other out there that want to give it a try? So here's our differences and treatment. So signs and symptoms. An overheated body over 105 degrees Fahrenheit, they're not able to sweat. This is your stroke, okay? Dry, hot skin, very flushed. You're going to have a headache, nausea, dizziness, or weakness. Breathing will be rapid at first and slows down and is shallow. Pupils are pinpoint. The brain, kidney, and liver damage could be permanently damaged. It is a life and death situation. First thing you want to do is cool down the body by dosing the body with cool water or apply cold, wet under the arms, under the neck, and the groins. Give cool drinks, maintain the airway, expose the victim to a fan or AC, and move to the hospital as soon as possible. Okay, heat exhaustion is caused by working or exercising in hot spaces, serious blood flow to the brain, heart, and lungs. Weakness, dizziness, headache, loss of appetite, nausea, appear ashen and gray. Cool, moist, clammy skin. The eyes are dilated versus in the stroke, they were pinpoint. You can have a weak pulse with breathing changes. So you're going to treat again for shock, loosen the clothing, apply wet clothes. Do not allow to be chilled. You want them cool, but don't allow them to get chilled. If conscious, give them saline water. If victim vomits, do not give any more. The reason is this is because with heat exhaustion, they're losing fluid and they need to retain their fluid. Okay. So which one do you think is which here? What is this guy? What do you think he is?
Stroke, heat stroke.
Okay. Okay. What's this one?
Exhaustion. Is that exhaustion?
Okay. So stroke and exhaustion. Okay. Requirement 19, what do you do if your clothes catch on fire? What have you all been taught since grade 1?
Stop, drop, and roll.
That is right. So if your clothes catch on fire, pour water if available, wrap a blanket around you, stop where you are, drop to the ground, do not run. So you're going to stop, drop, and roll. Very good. What are the basic fire prevention principles for the home? You're going to want to check your wiring. You're going to want to check your electrical, your smoke detectors. Have the batteries been changed in the last 6 months? You don't want to overload circuits or extension cords. You don't want to put any rubs or cords under heavy traffic where they could always be walked on. This will break them down. You want small appliances to always be unplugged. In our family, they had friends that were firefighters, and they said the most thing that causes fires in the home are plugged in toasters. So in their home, they always unplug the toaster after use. And you have portable heaters. They do not need to be in a crowded room. They need to have their own space. And you're not going to put anything over them because they can cause a fire.
In Nevada, that was the most
Yeah.
fires.
Fireplaces must have a screen to keep embers from sparking out and keep chimneys cleaned annually. Well, that could be them. Here. Can we find this last one? All right. Mhm. So now we're going to go basic water safety principles. Learn to swim. Swim in areas where lifeguard is on duty. Wear a personal flotation device around water. A young child and weak swimmers need their life, you gotta go back. Previous slide. Okay. Set limits for unexperienced swimmers. They do not need to go higher than chest deep. Inspect the waters for hazards. Swim parallel to the shore if you're in the beach area.
You don't have anything for us either. Let's go to slide.
I don't know, probably down here. Okay. Thanks. Okay.
Yeah. Slide sort of.
Again, up.
There you go. Right. Mhm. Okay.
All right.
Let's go with the gut test. No, okay. Times is not true. So I guess it's times.
Do we have any questions while I'm trying to fix this? Are you able to keep up with me?
What all do you guys know about swimming and swimming safety?
You should never swim alone.
Yes, true. Well, if they have signs around the areas, around the swimming areas.
You should
Oh.
read them because like it might show like there's a strong current and you have to like wear a life jacket or something or not
Yes.
swim there.
Yes.
There's also such things as undertows, and you can't see them above ground, but you can sure feel them under the water.
Yeah, it's lovely.
You also have to be careful with riptides.
Yes. Yes.
Do you know what a riptide is?
A riptide is whenever there's a current that goes under, that pulls you under from a beach.
And it pulls.
That would be an undertow. I have a picture of a riptide. It's where it splits.
A riptide is a focused current pulling in a particular direction.
That's right. Trying to get caught up with how many times you first get.
Okay, if there's signs by swimming areas that say danger? Do you read them and obey them, or do you just go on about your business and do what you want to do?
You should just listen to them.
Yes, because they're there for a reason. How do you get somebody out of water without getting into water?
You pull them from.
You could throw a life jacket.
Yes. Yes. Or what else can you do? Okay.
We can throw a rope too.
Okay, here's your basic water. I think we are okay now. Let's see. So this is a rip current, rip tide. Okay, what? So you got to get out of the water when thunderclouds are seen or lightning, right? What happens if the lightning strike hits the water and you're in it?
You could get electrocuted.
Right. We don't want to do that, right? Okay, 22, where are ways to save a drowning, what are ways to save a drowning victim? And what's he got here? He's got a pole. He's having the victim grab the pole to pull him out. Someone that's drowning is going to haul out, yelp, help, and they're going to be raising their hand. They're in trouble. Unless you have been trained properly, avoid swimming to the drowning victim because a non-swimmer is typically in a panic and may grab anyone or anything, and then you're both in trouble, and then you both need somebody to help you.
They'll grab you and pull you under as well.
So you're going to try to coach them in, throw a life jacket at them or flotation device, reach an item out to them, such as a rope, pole, or a paddle to swim. Once the victim grabs it, pull them in. You can wade in shallow water to attempt the above, but only to the chest. Okay. We just have two more. What are the basic electrical safety principles? So this lady is teaching this child about plugins and appliances, right? Okay. So your electrical do's and don'ts. Use the extension cord rated for its specific appliance. And shut the power off before working on a circuit. Unplug the appliance when not in use or needed repair. Replace a frayed electrical cords. Do not overload the circuits. Do not use electrical appliances in the bathtub or shower or standing in water. Do not use landline phone or touch any wired appliance during an electrical storm. Do not stick anything in the electrical socket other than an electrical plug in good condition. Okay, here's a little quiz for you. Which one is not correct? You see these pictures?
The bathroom one.
Correct.
Yeah, the one with the bathtub.
And the cat?
Yeah.
Yeah, you got electric heater, water on the floor, got a blow dryer, tub full of water, electrical radio. And this one is not real safe either, right? Aren't these two a little young to be handling anything? This one has a Band-Aid over an electrical outlet. So the only one that's safe is this one. And those are the covers that you want to put in electrical outlets. Okay, 24, our last requirement. How can you prevent food poisoning? You're going to check them. You're going to clean them properly. You're going to separate the food properly. You're going to make sure it's well cooked, it's well chilled, and throw away if it's outdated. Okay. The basic rule for storing food is to pay attention to the temperature. Keep hot foods hot and cold foods cold. Most bacteria will grow in food that is hotter, will not grow in food that is hotter than 140 degrees, and bacteria grow greatly slowed at temperatures less than 40. Food poisoning is often caused by eating leftovers that were not properly or promptly refrigerated. As soon as the food temperature falls below 140, it should be refrigerated. If the food is left in the danger zone out too long, bacteria will multiply. When storing hot food, do not use large containers. It takes longer to cool the middle, providing ample time for bacteria to grow. 5 keys to safe for food. You're going to keep your hands clean, separate the raw and the cooked, cook thoroughly, keep food at safe temperature, use safe water and raw materials. Okay. When handling raw meat and eggs, you should always consider them as being contaminated. And you don't want to handle other things without washing your hands. You don't want to, let's see, raw meat should always be considered as contaminated. Cooking these foods kills the bacteria, making them safe to eat. Do not allow other foods to come in contact. They will become contaminated. Do not use the same utensils to handle raw meat and eggs that is ready to eat. They could become contaminated. Okay.
And you always, always, always wash your hands before and after handling raw meat and eggs.
And this is our last slide. So now you can all go and save lives and take care of the injured. And that's my presentation.
All right. Thank you very much, Jeanie.
Sorry I went over a little bit, but we had some difficulties.
That's okay. We got done before the next meeting starts. We have half hour till the next meeting, so it gives everybody a chance to go to the bathroom, get a drink, look up their Zoom number for their next meeting, and get signed on. Thank you, everybody.
Yeah, thank you for joining, and I'm hoping that you learned something. I hope I didn't go too fast. It's a lot of material.
All right. Now remember, as always, guys, for these online ones, just take your notes to show to your director to show that you attended. And well,
Thank you.
You're welcome.
Thank you.
You're welcome.
All right, bye-bye.
I hope I've taught you something.
You did.
Good. Okay.
Stop sharing now.
I am ending the meeting.